All right, guys, this week's content series is going out to Amr Khan, a good friend of mine I actually grew up with. He received a hip flexor injury, and we're going to talk about how to open up the hip, strengthen it, mobilize it, so on and so forth. So it's all about the hip this week. Start from here and kind of in the back. They come through, wrap around, and connect on the femur, the leg bone. Their job is to do this motion here. This is called hip flexion, and they're most stressed when in what we call hip extension. That's this. So we're going to talk how you can mobilize and myofascially release your hip flexors. You can use either a peanut or a kettlebell, and we will use it to myofascially release / mobilize the tissue of the psoas and the iliacus. Hey guys, we're going to release our iliacus. Remember, our iliacus is on the side or inside of our pelvis. So you have your pelvic crest. Right inside that is iliacus. So kettlebell, you're going to place it right inside that pelvic bone. Sink and hit. It sucks. You're going to expose, you're going to tuck your hip a little bit. You're going to lift your leg in the air, keeping your low back against the ground. Slowly lower that leg and bring it back up. Over psoas release today. So this goes 2 to 3 inches, like that far away from your belly button. You're going to roll over on top of it. Like so. You're then going to, hands out flat like so. You're going to drive your knee into the ground here, exposing the psoas, and then pull your heel to your butt, and you rinse and repeat this until the tissue is mobile. So as far as treatment for an injury goes, everybody, the first thing you want to do is calm inflammation. If the body's inflamed or tense or in defense mode, you're not going to be able to do much. After you've calmed inflammation, you can then create access, which you can do via like either a stretch. And then lastly, you want to strengthen the range of motion that was previously lost or that you now have access to. But that is a step-by-step procedure to recover from an injury. Hey everybody, we're going over day 2 of the content series. We're going to go over how to create access after calming inflammation. Second step of treating an injury. So the thing you can look forward to learning the most today is how to improve access to your hips. So guys, passive stretching is a type of stretching in which you stay in a position for, a set time. You like to apply like an external force. The goal is to create and increase the maximum length of your muscle tissues. All right, guys, so we're talking about active stretching now. And active stretching is different than passive stretching in that it involves an agonist and antagonist pairing. Meaning that while you're engaging one muscle, you're trying to calm the other muscle. So it's pretty unique. They kind of just lean forward, open this up, and just stretch your hips like this. Now, the detriment of doing this is if you look at my low back, I'm arching my low back, throwing into my low back to stretch this. This is a passive stretch, but this isn't going to get us the want and need. This isn't a position that you're likely to visit in your workouts. You want to do something a little better that will thus help you prepare for your workouts versus just want and need. This isn't a position that you're likely to visit in your workouts. You want to do something a little better that will thus help you prepare for your workouts versus just if you want to be doing an active stretch, here's what you need to be doing. So I'm in this position. I'm going to actively try to drive my knee this way and try to pull my heel to my butt, engaging my hamstring, forcing a bigger stretch here. Oh, this sucks. Hold for 5, 4, 3, relax. And you rinse and repeat this. So once again, driving me forward, pulling my heel to my butt, causing a really big stretch right here. 3, 2, 1, relax. This will help you open up the hip. It will help you kind of get rid of a feeling. Hey everybody, today is the last day of the content series and we're going to go over how to build hip flexor strength today. So look forward to learning a couple exercises that will help you do that if you're one of those people who feel like they have weak hip flexors. This week, guys, we talked about how to recover from an injury and the 3 components that you need to do that. The first one, obviously, is reduce inflammation. We do that with myofascial release. The next one is to create access, and we've discussed active stretching, and then we build strength. Building strength will look differently for everybody, right? Depending on your age, skill level, past experience, you'll probably need something else, or something that works for someone may not work for you, and that's okay. It just means you have to get more specific and targeted with your specific strength needs. So guys, keep in mind that there are 2 strategies you can use to essentially build strength. The first is, of course, traveling through the biggest, fullest range of motion possible. The other one is working on the end range of motion, so kind of going to areas where you are most weak. So when you take an area like the hip through a full range of motion, you're going to get a couple of things. You're going to get improved joint function, you're going to get improved muscle activation, and of course you're going to get, from those things combined, improved movement quality. Hey guys, so I'm about to take my hip through a full range of motion. This exercise can be performed with that weight, with a band, whatever you like. So I'm here, grabbing my rig. I'm going to bring my knee as high as I can, really pulling against the band, holding at the top, and slowly loading out, really essentially loading my hip flexors. Might even feel my core a little bit. And this is one of the ways, once again, we can strengthen our hip flexors. Hey guys, so the last exercise we're going to do is take the hip through the end range of hip flexion. So a lot of people end up being weak at the end of their range of motion, actively at least. So what you're going to do is, you're going to sit like this, you're going to stay seated, you're going to apply force in the ground with this leg as high as you can, and then come down. You might feel some cramping at the hip, you might feel some cramping at the quad, that's okay. You might not be used to having your knee extended like that. So pressing into the ground. So guys, end range of motion training often builds strength in positions and areas where you're most lacking. Normally it's at the end of a range of motion where you might be weakest, and that could be risky depending on your daily or regular activities.